Hi, I'm Dr. Jonathan Buscaglia, Chief Medical Officer here at Stony Brook Medicine. Today we're going to focus a little bit on procedural room and operating room attire. Now I know everybody at Stony Brook does the right thing all the time, but today we're going to walk around the hospital and touch upon some of the do's and don'ts in and around our restricted areas within the hospital. Let's go. Good morning, Dr. Corrado.
Good morning, Dr. Buscaglia.
How are you doing this morning?
Doing well, thanks. And you?
Pretty good, but it looks like we may be off to a little bit of a bad start. I see you're coming in the hospital with some operating room scrubs on.
You know what? I should have realized that. Blue logoed hospital scrubs should never be worn outside of the hospital. Rather, a fresh pair should be gotten every morning and then returned to linens at the end of the day.
That's great, but what about that track jacket I see?
I should have realized that too. Only a white coat or a blue snap jacket can be worn over blue scrubs while they're in the hospital.
So what do you think we should do about this?
I'm going to go downstairs to linen, return these, and get a fresh pair of scrubs. And then I'll also remind people when I see them that this is something we should all be doing.
That's great. Have a great day, Tommy.
Thank you so much. I'll see you at linens.
See you later.
Take care.
Dr. Daoud, nice to see you, properly dressed with the appropriate mask covering your face, your facial covering on your beard, and your cap covering your hair.
Yes.
And I see that you're taking off your mask completely when you walk out of this semi-restricted area.
Yes.
And you have a head covering which is completely covering your hair.
Yes.
Why do we need to do these things?
In order to have a sterile environment in the OR and to promote patient safety.
Well done, my friend. Dr. Titosian, hold up. Good morning.
Oh, good morning. How are you, Dr. Buscaglia?
Good. I see you're headed into a restricted area and you don't have your mask in appropriate position. It was dangling and you have a lanyard on.
You know what? My mistake. Thank you for bringing that to my attention. I'm never supposed to enter a semi-restricted area with a lanyard or a dangling mask.
Right on. Excellent work. Why don't you get a new mask and get rid of that lanyard for me?
Right on it. Thank you for bringing that to my attention.
Have a
Thanks
great
lot.
day. Well, there you have it. Thank you so much for joining me. As you can see, we strive for excellence when it comes to patient safety at Stony Brook Medicine. If you have any questions about proper OR scrub attire, don't hesitate to ask a colleague, a nursing lead on the unit or around the OR, or even our friends in infection control.